When 2009 began, the matrix of Israeli control over the West Bank was as intense as ever since the occupation began in 1967. The dramatic proliferation of settlements, checkpoints, restrictions, and walls was slowly turning the West Bank into a series of cantons disconnected from each other and light years from Jerusalem. When 2009 began, the siege of Gaza, the starvation and deprivation of its people of every basic right and need was ongoing. The world's largest outdoor prison, home to 1.5 million people, had to find shelter from bombs, phosphorus, ground invasions, and sea bombardments without an appropriate access to medical treatments. When 2009 began, peace looked more than ever like a far-off dream. In response to such challenges, the Palestinian Medical Relief Society aims to improve the overall physical, mental, and social well-being of all Palestinians, regardless of racial, political, social, economic, or religious status, by pursuing its mission of quality health for all in over 490 communities throughout Palestine. PMRS health programs focus on the needs of the most vulnerable members of Palestinian society, such as women, children, and the poor in both rural villages and urban centers. It deals with issues related to poverty, access restrictions, availability of infrastructure, capacity, and resources, so as to overcome basic and daily health problems emanating from the Israeli occupation.
I am a doctor.
No, why?
I am a doctor. I want to go to my job, and there is a lot of patients waiting in this area.
PMRS also seeks to influence national policies to contribute to the strengthening of civil society and national unity, to strengthen the steadfastness of the Palestinian people, end the occupation, achieve freedom and prosperity for the Palestinian people, and build an independent, democratic, and fully sovereign Palestinian state with health care for all. PMRS approaches health issues from a broad perspective based on the right to health guaranteed by International Human Rights Convention and Article 25 of the Universal Declaration of Human Rights. It is implementing programs in different domains ranging from health education to emergency healthcare. During and after the Israeli military attack on Gaza, PMRS emergency response teams risked their lives time and again to save others. 70 medical professionals, joined by hundreds of volunteers, helped providing basic medical care, assistance, and psychosocial services in Gaza. Through its emergency response program, PMRS provides services to areas highly isolated by the separation wall and checkpoints, first aid trainings, as well as individual and community medical services through the dispatching of mobile clinics. By abiding to its struggle against poverty, discrimination, and isolation, PMRS activities and programs mainly focus on the provision of direct health care to all. PMRS, with the help of local and international partners, is working hard to support the communities and individuals trapped in so-called no man's land on the western side of the wall. As such, PMRS Primary Healthcare Program offers health services to over 1.5 million Palestinians in close proximity to their homes by supplying 24 general and specialized clinics throughout the West Bank and the Gaza Strip. Its laboratory program continues to provide high-quality, low-cost laboratory work and free chronic disease testing to every sector of Palestinian society. In turn, PMRS Pharmacy and Rational Drug Use Program focuses on providing necessary medicines of high quality for moderate prices to the largest number of patients through its fixed and mobile clinics. PMRS programs also addresses the specific needs of vulnerable groups through its women's health and child health programs. The Women's Health Program provided services to more than 400,000 women in 2008 through permanent women's health clinic and outreach program in 22 areas of the West Bank and the Gaza Strip. Services provided in this program include clinical services for pregnant women, postnatal care, family planning services, gynecological care, and testing for breast and cervical cancer. On the other hand, the Child Health Program is the cornerstone of PMRS work, involving the most physically and psychologically vulnerable patients. Through this program, PMRS continues to conduct early detection of disease and disabilities, to prescribe treatment for iron deficiencies, and to improve its school programs. PMRS also provides direct access to healthcare for disabled people. The community-based rehabilitation program has made possible for disabled persons to access high-quality rehabilitation centers where services are continuously being developed and improved. For instance, the Farah Rehabilitation Center in the north offers rehabilitation services as well as information about the reality of disabilities and the needs and services available in the northern West Bank. In turn, PMRS Mental Health Program addresses mental health issues of the Palestinian people and the development of adaptation strategies to overcome them through individual and collective counseling, psychological debriefing sessions, and summer camps. Additionally, PMRS has developed a so-called Loan Center in Ramallah, adapted to persons with specific needs, who are offered equipment and assistive devices, thus tremendously changing their quality of life. With disease patterns altering dramatically as a result of climate change or food insecurity, the rising burden of non-communicable diseases has been an increasing public health concern globally. PMRS Chronic Disease Program ensures the training of health workers, the running of a chronic disease center, community-based intervention, and the production of health education materials on the issue. In 2008, PMRS Youth Program reached a total of 15,000 youth, equally divided between males and females. The youth program attempts to simulate the hopes and aspirations of the Palestinian youth in order to develop their abilities to interact with and construct civil society. 4 youth centers are functional in the West Bank, in the cities of Hebron, Ramallah, Bethlehem, and Nablus. Summer camps, folklore and artistic activities, voluntary work programs, first aid trainings, and health education workshops represent regular activities conducted by youth enrolled in the program. Finally, PMRS is very much engaged in promoting health awareness within Palestinian society. Its health education and promotion program attempts to provide information on how to prevent disease and illness from occurring, as well as on how to treat them. The messages relayed through various mediums encourage people to adopt a healthy lifestyle and to strive to maintain good health. In the same manner, PMRS School Health Program targets youth and children and aims to increase early awareness to a number of different health and safety issues, such as personal hygiene or nutrition issues. PMRS School of Community Health provides instruction to groups of students from different communities who, upon completion of the course, can graduate as community health workers. Through its 16 core programs, PMRS has strived to meet the humanitarian needs of the Palestinian people. Regardless of the challenges, PMRS never lost hope, never gave up, and never lost sight of its core belief and goals. Let us not waste more time and yet another opportunity. Let us not lapse into the vicious cycle which has consumed so many lives and flaunted so many chains. When 2009 began, the matrix of Israeli control over the West Bank was as intense as ever since the occupation began in 1967. The dramatic proliferation